If you're over 45 and believe sexual decline starts when you finally feel it, then you're already late. Because the real damage doesn't begin when performance changes. It begins years earlier while your body is still convincing you that everything is normal. No pain, no warning, no clear symptom. Just small adaptations happening quietly. Until one day, the response is weaker, slower, less reliable, and you can't point to when it started. Hello, I'm Dr. Ananya Rao. I work with men's health and urology. And on this channel, I explain medical topics in a clear, calm, and practical way so you can understand what your body is doing before it reaches a breaking point. In this video, I'll explain what is really happening inside the male body after 45, why sexual power fades silently, and why most men only start asking questions when the process is already advanced. Sexual function in men depends on three systems working together seamlessly: blood flow, nerve signaling, and hormones. In your 20s and 30s, this coordination happens almost automatically. Blood vessels are flexible, testosterone levels are high, nerve signals are fast and efficient. The body compensates easily for stress, poor sleep, or occasional excess. But after 40, something subtle begins to change. Blood vessels slowly lose elasticity. Hormone production declines year by year. Nerve signals take slightly longer to reach their target. There is no alarm for this, no clear symptom you'd recognize as medical. And that's why most men miss it. The body adapts so well that decline hides inside normality. And here's the part most men never hear. Sexual response is often the first system to expose these changes long before the heart, the brain, or daily energy levels complain. The first silent shift happens in the blood vessels. An erection requires rapid, high-volume blood flow under pressure. When vessels are young and elastic, this happens effortlessly. But over time, the inner lining of blood vessels stiffens. This process is gradual and painless. You don't feel it in your arms or legs, so you don't suspect it elsewhere either. And this is why many men who feel perfectly healthy everywhere else notice sexual weakness first. Not because the problem is sexual, but because sexual function demands more from circulation than almost any other system. The second silent shift is hormonal. Testosterone does not collapse overnight. It declines slowly, roughly 1% per year after 30. By 45, many men have already lost a significant portion of their peak levels. Testosterone influences far more than desire. It affects firmness, recovery, confidence, motivation, and mood. But because the decline is gradual, men rarely associate these changes with hormones. They blame work stress, aging, responsibility, life. And here's what makes this dangerous. When testosterone drops slowly, the body learns to function with less until it reaches a point where compensation stops. The third shift occurs in the nervous system. Sexual response depends on fast, precise communication between the brain, spinal cord, and peripheral nerves. As men age, nerve sensitivity decreases slightly. Signals weaken. Response time lengthens. You don't feel nerve aging directly. You only notice the result: slower reaction, reduced sensitivity, inconsistency. And because there is no pain, no numbness, no dramatic symptom, this change is usually dismissed. The fourth factor is chronic low-grade inflammation. Many men over 45 live with constant inflammation caused by stress, poor sleep, irregular eating, high blood sugar, or metabolic strain. This inflammation interferes with nitric oxide, the molecule that allows blood vessels to relax and fill properly during arousal. You don't feel inflammation inside blood vessels, but sexual response feels it immediately. And this explains why men who manage stress poorly, sleep less, and sit for long hours often experience decline without understanding why. The fifth factor is psychological, but it begins in the body. Once weaker response occurs a few times, the mind starts to anticipate failure. Anxiety activates stress hormones. Stress hormones restrict blood flow. The loop forms. Physical change creates doubt. Doubt worsens response, and silence allows the cycle to grow stronger. Most men never talk about this, not with doctors, not with partners, sometimes not even with themselves. I want to be very clear here. These changes are common. They happen to most men with age. This is not failure. This is not weakness. It's biology operating quietly, efficiently, until it no longer can. You are not broken. You were simply never taught how this process works. Every man is different, and the factors I've described are common, not exclusive. Some men may have thyroid conditions, undiagnosed diabetes, medication effects, or other contributors. This video is educational, not diagnostic. If you're experiencing changes in sexual response, energy, or confidence, speaking with a qualified doctor is not something to avoid. It's how clarity begins. Now let me ask you something important. How long has it been since you evaluated your health beyond basic symptoms, including hormones, circulation, and metabolic markers? This channel exists because most men only receive this information when quality of life has already declined. If you want to understand your body before that point, not after, then this content is for you. Subscribe, because the next video explains a hidden factor most men overlook even during medical checkups, one that affects sexual health, sleep, energy, and mental clarity at the same time. Once you understand that piece, the entire picture changes. I'll see you there.